Everyone, Sandy Grove, registered nurse RN with Health Tracks at Home again. I have so enjoyed doing these videos with you. This is my 15th one. I can't believe it. But it has been a lot of fun bringing some health topics to you. A lot of things have changed. Haircut, 5 inches off, big deal, cooler. But I have enjoyed watching them over again and seeing, how I do videotaping. It's been kind of a hoot. So again, a lot of things have happened again this week. A new changes. It seems like every week there's something new. Things are dimming back down, as our governor says again. But I'm going to go ahead and continue the talk on being your own health advocate, because the switch is going to go back up again in the next month or so. And we will be going out in public doing our essential needs. And so it's a good idea to talk about some little ways to stay safe. And Ed and Edie are so good about giving us a little bit of encouragement and love and reminding us that we're not alone in all of this, that we're all going through the same thing. I think about all of you often, and I do look forward to the day that we can be healthy and be together. So I'm going to continue with being your own health advocate. We talked about some basics last week and then started on some specifics. We talked about the gas stations, we talked about food and groceries, and we talked about at church how you can protect yourself and what to do, some options for pharmacy needs. And I wanted to remind you about gas stations today. That was one of the things I mentioned way at the beginning when COVID had just started, and we spoke at church, if you were there, that gas stations have been identified as the #1 place for transmission of virus, influenza virus. People that are sick, as we know, go get gas anyway because they don't think they're going to come in contact with anyone. They get out of their car sick, they touch everything, they get back in their car and they leave. They also go to the pharmacy. They have to get the things that they need when they're sick. So these are two places you need to be extra special careful. So I would recommend, if you do have gloves, to wear gloves when you pump your gas. Remove the gloves, wash your hands, wash your credit card before you get back into your own car. Some of the gas stations have got gloves there, but I would recommend that if you can, get some disposable gloves. If not, wash your hands really well after using the pump and before getting into your car. Hair salons and barbershops, which just got closed back up. I'm so glad I got back in. Just a couple of things, because some of the barbers and hairstylists are going to be doing cuts, etc., outside. And so these things still apply. I found that when I went in, I was wearing a cloth facial covering, and it was very warm. Luckily, my hairdresser, in her stack of little clean area, she's got all this stuff there for people to use. She had disposable masks. And as a nurse, you'd think I'd know, but I'm so used to wearing a mask and it just doesn't faze me. She gave me a disposable one. Oh, it was great, because I was there for 3 hours getting my hair done, and it made a big difference. So I would recommend, if you do have disposable masks, that is a good place to use it. Remember to be careful with your credit card when you're paying the hairdresser or the barber as well. They should have everything posted. Even if you're outside, there should be some kind of posting of how they're going to maintain their health barriers. So ask to see that if you have not already done that. When you go out and exercise, just a couple of things. We want to make sure we get out and we go, even though they're telling us to stay at home as much as possible, but we do need the sunshine. I'm getting a little stir crazy staying at home, and I'm sure you are too. When you do exercise, pick those times of the day when you know people are not where you exercise. Try to avoid people as much as possible. If you do see someone coming, make sure you get your mask up and you move to the side. Sidewalks are a hard place. You can't fit. There's no way to get 6 feet distancing. So I just we move over and smile with our eyes. Remember to do that, because people can't see that through your facial covering. And then go on, say hi, whatever you might do, and then continue walking. But the best thing to do is to try and walk where there are not a lot of people. And then you do not feel threatened. You feel like you can be safe and you can get your exercise. Banking. This is probably something I don't need to talk to most of you about, but it came up recently, so I wanted to make sure that I talked about it. If you do not do online banking, this is the time I would really recommend you do everything online. Also, just recently, I got my bank's app for my phone, where you can take a picture of checks. I know we don't get that many checks anymore, but I've been starting to get checks because of my dad's estate and some things that are going on. And so I said, what do? I don't want to keep running back and forth to the bank. So I got the app. It is secured, it is safe by your banking institution. They are, as much as it can be safe, they're keeping it safe. So I would recommend that. It's a good way to deposit a check if you get one. So it's not sitting on your piano for the next 6 months until we can get back to the bank. But online banking is definitely a good idea. If you have to go into the bank for any reason, like your safe deposit box, you got to go in. There's nothing you can do about that. You may need to get your passport or something else. Call the banker beforehand and let them know that you're coming in so you don't have to stay there any longer than you need to. The other thing is a notary. If you need a notary, the bank is a good place to go get that. However, you are going to be exposed to all the people that are in the bank at that time. So again, call and make an appointment with the notary so that you can get your business done in a quick and timely manner, sequestered away from the rest of the people, and then you can leave as soon as possible. Just a good idea. Mail and returns. We're doing, probably everybody I'm talking to is doing a lot of online shopping, online ordering, not taking the chance to go into those malls, et cetera, where you may run into other people that might not be following the same guidelines you feel are necessary. So online is great, but for many, many months, they were not letting us send anything back. They are now letting us do that. And most of the bank, I still got banking on my mind, senior moment. Anyway, most of the companies that you could order online have a return option, and most of them are free now. They're trying to do that. Look for the UPS pickup option. You can either deliver it to a UPS station, which is actually pretty safe, and there aren't a lot of people there. Except at Christmas time, and it'll really be busy at Christmas time this year, but for right now, it's not that busy, so you can feel safe to drop something off. But they will come to your door, and it is no charge for most places. They'll come and they'll pick up the package, you just put it back in the same box, and they'll pick it up. And they usually ring the doorbell, which is really nice because most companies don't ring the doorbell. And then we're going to talk, the last thing we're talking about is medical appointments. I know that you've all seen that we have got some healthcare outbreaks. They're not telling us where, so we have to act like wherever we're going, it's there. So I recommend that if you have to have blood work done or x-rays or any other type of treatment, that you try and schedule it. And we do have to make appointments now, and that protects you so that there aren't 10 people waiting in line to get their blood drawn or get x-rays. You make your appointments, you can get in there and get out quickly. And usually they will do it around your doctor's appointment. Double check with your doctor's office that your appointment is still on, that they haven't canceled at the last minute, so you're not exposing yourself unnecessarily. And then again, with payment, hopefully your doctor's office already has you in the system and you can get billed, so you don't have to worry about trying to pay. Most of them are doing that now. And dental care. Now, most of us have probably gone, I'm not going to get my teeth worked on. That's not an essential need to get my teeth cleaned. I will only go in, and I've recommended that to you, to only go in if you had an emergency. But now they have got all the rules and regulations in place, and they have higher regulations in the dental office because the face is so close to you. The hygienist should be wearing a shield and a mask, just like you would if you were in the hospital and they were caring for an active COVID patient. So ask your dentist office before you go in for your appointment what their precautions are for you. And if you don't feel comfortable with it, ask them if it's okay to wait a few more months. They're all used to people canceling because we're told not to touch your eyes and our mouth. So we're like, okay, don't touch your eyes, your nose, and your mouth, but the dentist is in your mouth, the ophthalmologist is in your eyes. How does that work? So those kind of appointments are the ones that you want to make sure are necessary. Obviously, if you're going to have some kind of a test with the ophthalmologist, you need to go. And you can ask them what, again, like I said, be informed, ask them what their cleaning protocols are. And you should see the person wash their hands right in front of you. If they don't, ask them how often they wash their hands. They're not going to be insulted. So these are just another few things to help be a good health advocate for yourself. And I'm sure next week things will have changed again, but I'm planning to talk about at that time, what do you do in this day and age, in this COVID environment, when you have to go to a brand new doctor, and you may have to do it on the phone or you may not even get to see them, or you may have to have surgery. How do you deal with the preparations for surgery in this environment. I've had quite a few questions about that, so I wanted to make sure I addressed it. Again, it's staying informed. Be informed, know what's going on. Make sure you know what's going on, and preaching to the choir here, what's going on in our world around us. Stay safe, wash your hands, social distance, wear those facial coverings, stay home for everything except for essential needs. Enjoy, pray, and seek your friends and say, how you doing? I love you guys. I miss all of you, and I know that you miss all of us. And we too will be back together again. This too will pass. We know that. And we know that our Lord is in control of everything. So this is a good time for all of us as the church to pray and to ask God to heal our land, to forgive us and to heal our land. And that, I think, is our job as the church right now, to really pray for those around us. I'm very aware of those that are in need, those that are having surgery, those that are sick, much more than usual. I identify with them on a daily basis, not just once in a while. I'm very aware of what the needs are. We heard a pastor this last Sunday that said, how are you blessing? How are you passing on? What are you doing in this COVID environment? And kind of made me go, oh, okay. So we talked about it. We said, all these people that are coming to our door, that are bringing us groceries, that are bringing us deliveries, if they do stop long enough, which sometimes they don't, that's an opportunity for us to not just say thank you, but to say, God bless you. Thank you for what you're doing, the sacrifice that you are giving to us so that we can be safe. And we've started to do that, and people respond so amazing. I don't think people are doing that, but it's just a little tidbit of how to pass the love of Jesus Christ out there in this crazy health protected environment. I love you all. God bless you. I'm looking forward to next week. You take care and God bless. Bye-bye.